Hello everyone, it's Carolyn, and this FAQ segment is about understanding outcomes. We've had many conversations together about how frustrating it is to try in relatively short time frames with relatively small amounts of money to demonstrate outcomes. It's important that we demonstrate outcomes and ultimately their impact on the health of the public that we're serving. But what I have always said to you in training is that every outcome, every major achievement that we accomplish in public health is rather like a building. It's something that we've built with lots of other small achievements. And so we've built this pathway towards this ultimate accomplishment in changing some health indicator, for example. And so the way I like to think about putting programs together is that it's almost like putting programs together with Lego blocks. That each of these blocks is an outcome in itself and something that needs to be accomplished in order to see the public health outcome. Now, in some cases, people will say, well, I don't really want to hear about all your interim outcomes. I don't want to hear about the infrastructure you had to build or the partnerships you had to develop or the resources you had to assemble. I just want to know, did you change the way that our population was able to, say, manage their type 2 diabetes? Well, that's fine. And for some funders or for some audiences, that's the only outcome that they might want to hear about. But you and I know that if we don't think about all these little pieces that we're using to build our program, then we're never going to achieve outcomes. The other frustration that we experience, and those of you who've heard Professor Steve Terrett talk, know that he often says that one of the frustrations that we experience as preventionists is that if we do our job right, we don't see anything anyway. And so for the mental health of the people you're working with, for the mental health of your team, it's really important that you understand that you are achieving important outcomes that are putting you in a place where you can actually achieve these successes that may or may not be visible to the public. So let's start with the analogy that I've used in class. And the analogy that I've used is getting a 2-year graduate degree. And so if I am thinking that I want to get a 2-year graduate degree because I want to be able to do a certain job, for example, then that might be an outcome that I want to achieve in order to achieve other outcomes such as career advancement or the ability to make a difference in the world. So in a very traditional model, I would start at the beginning of my program. I would have one major outcome, which would be my degree, and everything in between would be process. It would be implementation process. And so technically everything in between would be process evaluation and process measures, which we call outputs, not outcomes. However, if we were people looking at students coming through a 2-year degree program, and we know that there are certain outcomes or certain courses that have to be accomplished in the first year, then we would monitor those outcomes at the end of the first year. And if, for example, as an advisor, I have a student who's absolutely determined that she wants to be finished in 2 years, and I see at the end of the first year that she has not completed everything that needs to be accomplished in the first year, then I don't need to wait another year to know that she's not going to be finished on time. And so therefore I have the ability to meet with her and talk about a revised plan. You know, in my case, if I'm working with students who are working full-time and studying full-time, we might have a conversation about whether or not they can afford time-wise to work and study. But we know that there has to be an adjustment made, either to what's going to happen in that second year, or there has to be an adjustment made to when we expect to see this outcome of the 2-year degree. We all know that in most places, there are 2 semesters in a year. Now, we know at Hopkins we have the summer and 4 quarters, or we have 3 semesters in the School of Nursing. But what is really important for us to understand is that each one, the completion of each of these semesters, is also a very important outcome. Because similarly, if we don't complete, say, in the first semester, the first course of a series of 4 that we must take, then we know by the end of the first semester that we can't finish on time. And so we have to monitor that semester outcome. Now, some of you are in the fortunate position where you are being funded. You're being funded for your education, or you're being funded, somebody, say, in the hospital is reimbursing you for some of your training. Now, in many of these cases, you are going to be required to achieve a certain level of academic performance in order to be eligible for the reimbursement. So in this case, say, for example, you're working at the hospital and they're reimbursing your education. Then the person who has approved your funding is not just interested in the 2-year degree or the 1-year semester outcome or the 2-semester outcome, so the 4 semesters in the 2 years, but they want to know that you got a B or above in every course in every semester of that degree. So now we're multiplying the number of semesters by the number of courses, and we have that number of critical outcomes that we have to achieve. And for those of you who are taking anything for credit, you know that success is not about registering for the course, and it's not even about registering for the course and showing up. It's about registering for the course, showing up, doing the work, and succeeding in each of the deliverables that is required for the grade. So in some of my courses, I have 4 or 5, sometimes 8 gradable deliverables. Now that means if I ask you for 4 gradable deliverables for my course, then my course has 4 critical outcomes. So as we back up and back up and back up, you see that even though for some audiences it might be appropriate to say, I have 1 outcome, that 2-year degree, for the people who actually have to make the work happen, so in other words, for the student who has to make sure that they do the work for every course, they succeed in every assignment, they get a B or above in every course of every semester, that each semester they put themselves in a position to move to the next semester. Each one of these outcomes is absolutely critical. It's also critical to the advisor or the supervisor, because we know if the student is struggling to achieve these outcomes, then we need to be acting early. We need to be introducing some help. We need to be adjusting the course load. We need to possibly be thinking about a different timeline for this project. And so you understand how important it is that we really get very good at saying, what are all these small outcomes that have to be achieved and measured in order to know that we're progressing and that ultimately we'll achieve those longer term and very important outcomes. So we don't want to oversplit, and in the same way that you can't say, well, because I passed 2 courses in my first semester, I got the degree. That's not true, right? I can't claim that I got the 2-year degree just because I passed 2 courses in the first semester. But I'm never going to get the degree if I don't pass those 2 required courses in the first semester. So when we learn to think about our public health programs this way, it helps us understand that there are critical outcomes that have to be achieved before we can achieve subsequent outcomes and before we achieve our final outcome. This allows us to understand truly the amount of time and resource that's involved, and also it helps us adjust quickly and more efficiently if we see things going wrong. Of course, as with your degree programs, those of you who are in degree programs, as you move further through the degree and you continue to succeed, you know that the chances of success are getting better and better and better. You can look forward to graduation knowing that not only have you succeeded, but you've learned how to succeed. And when we have our public health programs learn how to succeed, then we set ourselves up for really good endings.